When we look at the WASH financing gaps, the 2026 national budget analysis that we recently published is telling us that WASH is receiving just 0.71% of the national budget, and that is the lowest it has been in 6 years. So in a year where we're coming just out of the worst cholera outbreak, in a time when we're coming out of the drought and still recovering from that, can we really afford to do with a 0.71% allocation for WASH in our national spending? We also find that the budget allocation is falling below the global and regional commitments. Even with our own national plans, we are falling short in terms of how much investment is actually going towards WASH to turn the situation around. Recently, we saw the disaster preparedness plan. Yes, WASH has a budget in that, but that budget has a zero allocation, 100% deficit, and it's waiting for those of us in this room to think carefully and see how we mobilize the resources that are going to ensure that that preparedness plan gets delivered as and when it is required. As Wateraid, we remain committed and I believe hopeful as well, because we do see the political will and we see the goodwill of partners as well coming together in spaces such as these ones to improve the situation. Some of the things that we're doing in the country in response to cholera, in Sylvia Masebo, one of our very exciting case studies, we served a population of about 9,000 people with safely managed water supply. A community previously categorized as a priority area for multi-sectoral intervention, aka a cholera hotspot. Since our intervention has reported 0 cases for cholera, just before the supply. We've worked in over 90 healthcare facilities in the Southern Province and the Western Province, Rusango Healthcare Facility being one of them, where women had to travel more than 30 kilometers to get to the next facility. They are now within a 15-kilometer radius where they can be attended to with skilled workforce, but also in a facility that has all the basic essentials: safely managed water, good hygiene, infection prevention control, effective waste management, all of that making a world of a difference to the women of Rusango community. In Nteme, which happens to be in the Southern Province and one of the areas that tends to face water shortages as a result of prolonged dry spells, one of the areas that also has been affected by health outbreaks, we responded there with a reticulated water system that is serving this farming community. And one of the biggest outputs that we're seeing from that program, which was somewhat unintended, is the growth of home gardening that's giving women additional food, but also releasing their time for them to engage in other economically viable activities, and bringing water security to this cattle farming region. So we provided a system that also gives safe drinking water to the cattle. And it's made a world of a difference now when everybody else is looking at water shortages in the surrounding areas, and Nteme is sitting pretty. Water is no longer a problem that they need to worry about. So our call, as I close, is really around investments for impact. Let's put forward resources that help us to meet the unmet demand for services, sustainably manage the services that are available. Let us prioritize WASH in budgets. Let us also scale up WASH in the key spaces: communities, schools, healthcare facilities. Let us integrate WASH with health, WASH with livelihoods, WASH with climate, to achieve more impactful outcomes and have a multi-sectoral approach to how our interventions are delivered to achieve maximum impact.